what comes next? The primary essence of this impingement, secondary to the shoulder dyskinesia or shoulder imbalance, is posture correction and physiotherapy. Coming to posture correction and physiotherapy, what are good ergonomic habits or what are good postural habits to follow in your daily routine, even if you are working from office or you are working from home? First and foremost important thing you need to understand is your shoulder blade has to be placed equally and symmetrically on the chest from the back. Now, if you are sitting on a chair which has a support to the shoulder or an ergonomic chair, make sure your shoulder touches to the chair at the shoulder level. Your desk comes closer and your screen is at eye level, so that you can properly sit like this in this certain way and work in this particular position. As you try to go with that same good chair, if you try to go and move forward and slouch and see at the screen, that will create a problem. In spite of keeping this good posture where the shoulders are touching the chair and your screen is at eye level, you need to break that posture every 30 to 40 minutes. Take a break of 2-3 minutes or so, but that break of inertia is very necessary. Second option for this is to use a standing desk. So standing desk, which is recently come up in many offices, even in the West, even in India, that is a good habit to use, maybe intermittently or as per your needs. Secondly, use of phone. Other than the desk work, what we are more used to a screen time is of phone. Phone use has to be again done in a particular way where your neck has to be at a higher level so that your phone comes up, it comes at your eye level and your shoulders are upright. So keeping the shoulders constantly or cautiously behind and neck at a higher level and holding the phone in a certain way where you don't have to slouch down and look down at the screen is the right way to use the phone. You should avoid using the phone while sleeping. You should avoid using the phone in any awkward position on the bed where your shoulders and the neck goes into a slouch. Third most common thing what you need to remember is if you start getting such pains, if you are started doing new activity or new exercises, then and there you have to stop doing this particular activity or exercise, take a break of few days, visit a shoulder surgeon or a physiotherapist, get it diagnosed and then go ahead with your exercises or with your sports. Coming to the treatment part, like I said, the most important part is, as mentioned before, is the posture precautions. So cautious posture precaution is the utmost important thing to correct this, which will take particularly around 6 weeks to 12 weeks time. Second important thing to follow is physiotherapy. Now what physiotherapist will do is he will do certain strengthening exercises for your shoulder muscle which has developed impingement or tendinosis, and he will try to balance out the shoulder blade, because the shoulder blade has couple of muscles attached to it and there is an imbalance. The exercises of physiotherapy will balance out the shoulder, strengthen it, your posture will get better, and eventually after doing over shoulder sports or over shoulder gym, you will not get that particular pain again. Following that for a couple of weeks to months is very important. You will not get a quick relief from all these symptoms. This is a process which will go on for a period of 2 to 3 months. So following that patiently, keeping good compliance is of utmost importance in treatment of this shoulder blade imbalance or shoulder dyskinesia.